The next speaker, please.
Yes.
Dr. Sonam.
Yes, sir.
Welcome.
Thank you, sir. Very good afternoon, everyone. Since it's the very end of our conference, so I'm going to be very brief. I'm going to discuss the swept source OCT applications for an anterior segment surgeon. There are no financial disclosures. So as we know that there are three different types of principles: time domain OCT, spectral domain, and swept source OCT. And I'm not going to go into the details of every principle, but I'm going to discuss cases based on the swept source OCT, that is the AIOCMT OCT. And it is a high resolution imaging system which has a very high scanning speed and can take 360-degree view of the cornea in up to 2.4 seconds, a very rapid method of corneal capture. And the anterior chamber parameters that are available with this machine is the anterior chamber width. You have a detailed values that are available for the ACD, the anterior chamber areas, iris parameters, as well as the lens parameters, along with the corneal parameters. Quantitative parameters, which are mainly used by our glaucoma colleagues, are angle opening distance, the trabecular iris space area, also known as TISA, the angle recess area, and the trabecular iris angles. So what's in store for us as a cornea surgeon? So this article by Professor Carol Cupp has shown that even in the patients of OSSN, where there was clinically there seemed to be a recession or complete resolution of the OSSN, 17% of the patients still had subclinical OSSN, which was detected on high resolution OCT. So that actually tells us about the importance of OCT. So this case is a classical OSSN. Here we can see there's presence of a hyper-reflective epithelium growing, encroaching upon the cornea. And on histopathology also it was diagnosed to be OSSN. But classically, here is the picture. You can see that there is hyper-reflective epithelium and the corneal epithelium, it's encroaching upon the cornea. And we can see there's an abrupt transition from the hyper-reflective epithelium to that of the corneal, relatively hyper-reflective epithelium. So this is classical imaging of that of OSSN, which we have to keep in mind. Another corneal conjunctival mass lesion, that is a melanoma. How is it different from an OSSN? Here you can see that the epithelium may appear a little hyperreflective, but it is not hypertrophied, and the subepithelial Bowman's membrane plexus could have some hyperreflectivity. Once you see this hyperreflectivity, this is basically due to the melanocytes that are deposited in the subepithelial space. So UBM is of course a technology of choice in such cases because owing to the pigmentation, the depth of penetration is poor in AS OCT. So here in the UBM we can see the scleral details better compared to that of another mass lesion which is pigmented, that is nevus. Nevus will show you the cystic spaces which are absent mostly in case of a melanoma. This patient was again histopathologically diagnosed and having conjunctival melanoma. Another condition that the corneal surgeon uses AS OCT routinely is an infective keratitis, and the swept source OCT has a very good penetration. So not only the corneal and the endothelial lesion, you can even go beyond, like looking at the hypopon as well as the lens abscess. If there's a presence of a lens abscess, you can detect it, and this we had published in ophthalmology. Along with that, we can even look at the recession, that is the scarring of the cornea which takes place after resolution. Apart from that, just like our glaucoma colleagues use the swept source OCT for determining the height of the bleb and the conjunctival fluid as well as the scarring thing. Here in this interesting case, there was presence of a bilateral subconjunctival fistulae which was present. On doing an AS OCT, we could see that there was communication from the anterior chamber directly into the subconjunctival space, which can be seen in Trabulsi syndrome. This patient, however, did not have that, but yes, we have a good penetration even through the sclera. Another interesting case that we found was this a case of a boggy swelling of the conjunctiva bilateral who had systemic melanoma, multiple myeloma. In this patient, on doing an OCT through the conjunctiva, we can see that there are hyperreflective linear opacities, which we have visualized here in the yellow arrows, in the substantia propria, and at the base, you can see there's presence of a hyperreflective nodular lesions, and this we had reported in, now it's going to be coming out in the IGO, as the AS OCT features of conjunctival amyloidosis, which you can detect even before doing a histopathology. As we all know that AS OCTs are routinely used for keratoconus cases. This is a case of a brittle cornea syndrome where the patient presented with one eye total loss of vision and with childhood trauma, and the other eye showing a very deep AC with a very thinned out cornea. Going ahead, and refractive surgery procedures with ICL planning along with that of the LASIK planning, we can use the AS OCT. In this case, we can see that there was a case of a 26-year-old male who had a very high vault in the post-operative period. We use the microscope integrated swept source OCT to dial the non-toric ICL in the vertical configuration. In the real time, we could visualize that the vault has come down. So this is another application of swept source OCT. So from 1040, the vault height came down to 650. And interface fluid syndrome, also known as PISC, you can look at the fluid that is in the flap area, and then after bringing the pressures down, the resolution can also be noted on OCT. Along with that, now quickly going to the cataract surgeries, as we know, the AIMS group has extensively published swept source OCT use in white cataracts. In our department, we routinely use it for babies, and being a very rapid technology and using the flying baby technique, we can actually image the corneas of the babies, as the incidental fixation is more than enough for this machine to take images, and we can get beautiful images in babies as well in the pre-operative period. This is the departmental publication showing the various morphology of congenital cataracts that can be visualized, and gives the surgeon more time to and also idea to decide the kind of surgery that they want to go ahead with, also to counsel the parents. Along with that, this is another publication of from our department which shows the correlation of the AS OCT with that of the UBM. So this AS OCT being having a good penetration, we can get anterior chamber details even in an opaque cornea. So here there are beautiful images which can be correlated with that of the UBM, we can see here. And another condition where we routinely use this technology is in metabolic corneal disorders. Like in this case, we can see there's a thickened cornea, stromal opacities, along with crowding of the ACs. The child had mucopolysaccharidosis type 1. Another case where cornea appears to be relatively of normal thickness, but there is presence of a hyperreflective epithelium basement membrane complex. On doing histopathology, we could find the thickened epithelial Bowman's membrane complex, and the child came out to have mucolipidosis type 4. So I would like to conclude by saying that swept source OCT is a versatile non-invasive imaging technique which facilitates qualitative as well as quantitative study of the ocular surface. And because of the greater penetration, it can be used further in studying the anterior segment structures, and its application in the pediatric corneal and cataract needs to be adopted in mainstream practice. Thank you very much.
Nice presentation.